Hi there, this is Judith and Desjardins in Santa Monica. I am in infusion room 3, but I have my own private room today, which is really lovely because I've been very claustrophobic when in that larger small room, and today I get my very own private room with a lovely window view, all of my own. And I'm very happy to tell you that my strategy of coming for chemotherapy every 3 weeks rather than every 2 weeks has made all the difference in the world. It's given my veins a chance to recuperate. It's given me extra stamina and clarity for living my life and handling small details that I was not able to deal with emotionally or mentally when I was coming too often and feeling very depressed and feeling very frightened to come. And great success today. I will show you that with my veins giving a rest, I was able to actually have this IV and catheter inserted on the very first attempt. This is my right arm, which had taken the responsibility of 4 infusions on this side, and the veins were totally blown out. So with a, 6-week break of not having anything, my vein was very plumped out and easily inserted the needle. I haven't gotten a printout of my test results yet today, but I know that they are good because otherwise I wouldn't be having my 7th infusion. My goal is to have at least 9 infusions because I am a stage 1 pancreatic cancer patient. I do not necessarily have to have the full 18 rounds of chemotherapy that a stage 2, 3, or 4 pancreatic cancer patient would have. So that I made a pretty dramatic decision that I did not ever want to have a port installed in my chest or a PICC line with a tube sticking out installed in my arms. And I told my doctor that I will receive as many of the 18 infusions as my body can tolerate if they are able to be administered through my veins so that I can see what the side effects are. So far, the only side effect that I've had is swollen arm that turns a bit purple and has some pain about 3 days after the infusion, but that only lasts about 3 days and then I'm good to go. I haven't had nausea, I haven't had diarrhea, I haven't had vomiting, I haven't had rashes or any of the other side effects that most patients get. So I think this is a very good strategy for me as a holistic therapist. I firmly believe that the body and its natural resources of its immune system, platelets, the neutrophil, all of those parts of the blood system need a chance to recover from the hit by the chemotherapy so that they can participate with the chemotherapy to seek out and kill any remaining cancer cells. So that is why I am feeling great. I have more energy, more mental clarity than I had in the last 6 months. I'm doing fine-tuned cleaning and paperwork and just all kinds of things, projects I had on hold that I couldn't tolerate when I was afraid of the chemotherapy and afraid of my veins and afraid of all kinds of things happening. Every time I came for chemo, I really was depressed and really kind of in terror each time I came because my veins were getting blown out and I wasn't able to come in and feel confident. So I encourage everyone out there to do and my nurse has brought me my test results, which are
Great.
Yeah. Neutrophil. Okay, thank you so much. So my blood work is looking very good. As you see, the main things that they're looking at are red blood cells, white blood cells, platelets are nice and high. The platelets are nice and high. And neutrophil has to be, it's at 175, which is very important. After my first bout of chemotherapy with the standard dose, which was too high for me, my neutrophil was all the way down to 0.48, which technically should have landed me in the hospital. So the doctor was obliged to lower the dose of my Gemsar so that my body could tolerate it. And so I'm looking very good. I am very happy today. This has been a state of grace day where everything is going well. So I encourage everyone with any type of illness to really be on top of the diagnosis you have, the research about it, the recommendations. I recommend you, during your research about the surgery, informing yourself about the best surgeons and the best hospitals that deal with your particular illness. I encourage you to be very assertive with the treatment team, with the doctor and nurse practitioner. You are the expert in your body. You are the one that knows how everything affects you. You are the one that has a philosophy of life and a way to carry yourself in the world.
Okay, it's all done.
And so I just encourage you to advocate for yourself and get the very possible results. Let your spirit guide you. Have trust in yourself and God to know what you need. And be strong and assertive with the treatment team. You're the boss. Thank you.